Hello, my dear viewers. Today we are going to see about the much hyped core muscle strengthening exercise adopted by the physiotherapist and other health influencers to bring about a significant improvement in low back pain. They in fact blame these core muscles as the culprit for low back pain. This is a detailed video about how this core muscle training has evolved over a period of time. It's going to be a little lengthy video, but just if you listen to that, a lot of questions may arise in your mind and you will start training people in a different way. So there are very importantly three important things which we have to consider when the core muscle training is being brought about by the so-called core muscle educators. So it was in 1990s this concept came that you have to strengthen this core muscles. What they claimed was there is a motor programming happening in the muscles of the core before when a person walks or stands, bend forward or whatever it is, these core muscles contract and support or they protect the spine. That is what was perceived initially. But as of now, the science have gone way beyond that, and a lot of researches have been conducted in this area, and it was found out that low back muscles, that is the so-called core muscle strength, do not determine the prevalence of low back pain. Example, there was a study which was done, which is quoted in the description link. You can see that the core muscle was weak for almost most of the people who did not have symptoms of low back pain. And vice versa, people who had low back pain presented with core muscle weakness incidentally, but some of the studies have stated that there was no much core weakness compared to the age-related normal people. The same was the core muscle strength. So for low back pain to happen, the core muscle strength did not contribute. So we will discuss these things in three important subheadings. One is using this transverse abdominis as the primary muscle for core strength. Second topic is going to be on the focus of internal factors and the external factors. And third thing is going to be the strength of the core muscles. So these three things we are going to see. So the first one, that is the transverse abdominis, is considered to be the primary muscle of core, which is responsible for protecting the spine. Well, there are some cases where conditions like pregnancy, obesity, where people have a distended abdominal muscles. The muscles length is so long, elongated, but still they don't have back pain. How far back pain is prevalent in the obese patients? By this time, if the core muscles are the only responsible person, every obese person should have the low back pain because their transverse abdominis and the rectus abdominis are stretched and they are mechanically in disadvantaged position. But why don't have low back pain? We have seen some stout people doing wonderful dance performance in the Instagram videos. This is one thing. Second thing is after pregnancy. Not all pregnant women get low back pain. It is observed because of the hormonal changes and the distension of the abdomen. You can very well note that these low back muscles and the abdominal muscles get distended, but still they don't get low back pain. Not all the pregnant women get low back pain. Only when they have some pregnancy issues, complications, or premorbidity, or when they have a history of low back pain, they'll end up into trouble. Or there is an overweight baby which they are carrying, which is going to put a lot of stress on the low back. So all these things are going to contribute, and not the core muscle strength. Okay, we will come to the surgical aspect. There are some abdominal surgeries which are done, which results in the dissection of the rectus abdominis and transverse abdominis, internal oblique, everything. But after surgery, how many of them land up in low back pain? Very few. So if that is the case, if core muscles are the one which is responsible for protecting the spine, all the people who are going for abdominal surgeries should have gone for low back pain, but that doesn't happen. And last but not least, even after doing continuous core exercise, why people get low back pain? If a low back pain patient comes to you, if you are training his low back muscles, every muscle takes on and around 6 to 8 weeks to get strengthened. So by the time, if they strengthen their core muscles by 6 to 8 weeks, they should never get low back pain. But still, why do they get low back pain? This is point number one, that is considering transverse abdominis as the only muscle which is responsible for core strength. Second point what we are going to deal is the timing of contraction. This is always being hyped in physiotherapy, that the core muscles start contracting far before the limb muscles contract when a person is standing or walking or sit to stand or he's bending to. So this is called as anticipatory postural contraction. This is well and true, but a lot of studies have been done in low back pain patients where they state that this anticipatory contraction is delayed in low back pain patients. So how you understood this, that because of the delayed contraction of the transverse abdominis and other core muscles, the person is getting into low back pain. But the recent understanding is entirely different. What we have to understand from this scenario is, because of pain, they adopt a different strategy to bend forwards, different strategy to stand, different strategy to walk. That strategy does not require premature contraction of the core muscles. Just I'll give you an example. If two persons are sitting, right, one A and one B, the A has low back pain, B doesn't have low back pain. Suddenly a snake comes up. So how this person gets up with a spring in their leg? The person without low back pain, he just jumps out of this and he run away. But the person with low back pain will have his own strategy where he has to escape from the snake. At the same time, he should not aggravate his back. He will protect his back. So we can't say that his strategy is wrong. The same person A who has low back pain, if he doesn't have low back pain, his strategy is different, and if he is having low back pain, his strategy is different to escape from the same snake. So these are all things which are very, very essential to consider. And moreover, the anticipatory postural contraction is 1/5 of a second, probably 12 to 15 milliseconds before the actual movement takes place, and that doesn't matters. But what core muscle strengthening school of thought educate you is, you have to contract the muscle before. You have to train how to contract the transverse abdominis in a crook lying position. You should have a BP cuff inside, and when you press the transverse abdominis, this BP cuff will compress and the mercury levels will raise, and you will have the transverse abdominis isolated contraction. Now, any of this is wrong, because when you take your elbow to the mouth, your brain knows that your hand is coming towards the mouth. Your brain doesn't know that your biceps is contracting after the internal rotation of the shoulder is done by the pectoralis major. It doesn't read like that. For the brain, it is taking the hand to the mouth. That's it. So when all these things are registered functionally in your brain, how training one particular muscle can bring about a dramatic change in the system or the ecosystem of the lumbar spine. So this is a big disputed thing. Again, during injury, if there is an injury to the low back, what happens? There is a co-contraction of the muscles. You have always seen. You can neither move to extension, you can neither move to flexion. So this is the scenario, right? You understand. Then, when the muscle is in a constantly contracted state, the transverse abdominis, the rectus abdominis, the internal oblique, everything will be in a erector spinae. Everything will be in a contracted state if you have a low back pain. Now, why do you have low back pain? Because already these muscles are in contracted state. Yet, why do you have low back pain? This is a high energy drain and expenditure for the muscles. So, these are the questions which have to be answered. Then, how can you reach which muscle to contract in a movement? For example, you are teaching a patient to contract the multifidus isolatedly. You are contracting the transverse abdominis isolatedly. But when I am doing forward flexion in supine lying, there are certain muscles which are active. When I am doing it from standing towards the gravity, there are certain muscles active. At the same time, the volume of contraction, the timing of contraction, everything differs. You have learned about the lumbosacral rhythm. So in that case, how do a layman know which muscle to contract to do certain activities? Because your day-to-day activity is not only about forward bending and lifting weight, not only about sitting to standing. There are so many activities that are involved in the life which has to be protected by means of the single isolated muscle activity teaching to the patients. So it becomes wrong. You cannot do that. So this concept of the first what we saw was selecting transverse abdominis as an isolated muscle to train. The second topic what we saw was the timing of contraction, that is the premature contraction of the stabilizers to stabilize the spine. So these are all proved to be wrong by the physiological studies. And the last but not least is the strength component. So there are no studies so far which have proved that strength of the muscle determines the low back pain. If you can show me a very good article with good number of volume, which is not done clinically, first of all, it should have been done with some objective outcome measure, then we can argue on that. So there are no such documented things which determines that muscle strength alone is not the determining factor for someone to have low back pain. Next is poor core strength results in LBA. So this is also not only the transverse abdominis, not only the multifidus, abdominal muscles also, if they are weak, that doesn't result in low back pain. There are no such documentations available. But often LBA patients presents with poor back strength. That might be simply because their activity levels are less. Most of the time, the low back patients who get low back pain, their activity levels are less. Most of the time, they are obese. Most of the time, they face some high velocity injuries or some sort of unexpected events. So in that case, definitely their core muscle was weak. It was like an incidental finding. It is not most of the time that this core muscle strength has led to the weakness. I really don't want to miss many points. That's why I'm just writing it up and I'm just reading one by one points, because in a rush to convey certain things, I may miss out some points, but that's why. Okay, but during standing, walking, lifting weight, there are studies, EMG studies, which have stated that the activity of these muscles was just 2 to 5% of their maximum contraction velocity, maximum contraction ability. So only 2 to 5% of the muscle contraction is happening in these core muscles, so-called core muscles, when a person is standing, when he is walking, and even when he is forward bending. So this clearly states that for these activities, the core muscle is not the major muscle which is performing. So you may be asking me, sir, when I do deadlifts, my low back muscles get stronger. But that is not normal circumstances. That is in a loaded manner. When you are doing it in a loaded manner, definitely your muscles are going to be activated, more activated, and the action potential is going to increase in proportion to what is the weight you are lifting, right? So it all depends upon the task, the environment, and the individual. So this is very, very important. Next, now the new models have evolved in low back in the core stabilization. Teachers started teaching this. Think about the core muscle when you are doing this activity. Think about the core muscle when you are lifting. Think about the core muscle you are bending. Think about the core muscle when you are running. This is how they train the low back pain patients. Come on, now I'll take an example. If Sachin is going to hit a sixer, is he going to remember this core muscle when he is going to hit a six to generate power? And Beckham is going to shoot a ball to the goal. Is he going to remember always that core muscle, core muscle? No, that doesn't happen that way. So this you have to remember. You can't imagine or premeditatedly think that you should contract a muscle voluntarily and then you can perform a movement. It is all a motor planning and motor learning that is taking place. In my next video, I'm going to post what are all the solutions for managing low back pain for physiotherapist point of view, right? So the take home message from this presentation is the core muscle strengthening is not going to improve the low back pain in any ways. So don't concentrate only on the low back or the core muscle strength. Concentrate on the entire musculature. Concentrate on the function rather than individual muscles. That is what I'm trying to prove from this video. Thank you so much for watching. Keep updating and keep posting your views on this thing, because these are all very controversial topics. There are people who might have more experience and information about this. Please communicate to me. Ready to argue and ready to accept. Thank you.